Hello, I'll be your nurse today. My name is Nolan. I'm going to do some hand holding real quick and provide some privacy for you. Gonna ask, can you give me your name and date of birth?
John Doe, 10/20/71.
Alright, thank you, sir. I'm going to raise the bed so I don't hurt my back in any fashion. And today I'm just going to be doing vital signs on you. And I'm going to be checking, listening to your heart and lung sounds. Before I do any of my assessment, do you have any allergies I need to know about beforehand? Like
No.
latex or anything?
No.
And then your skin, overall appearance looks good, nothing abnormal there. I'm going to go ahead and start on your vital signs. Before we even start, have you eaten or drinking anything in the last 30 minutes?
No.
You have not? Alright. Thank you. I'm going to first start by getting your blood pressure here. I'm going to feel for your brachial artery here. Got one right there. Alright. We'll listen to your blood pressure. And what is a normal blood pressure you normally range at?
It's just the normal range.
Normal range? Alright. Got your blood pressure of 122/78, 78. That's good blood pressure. That's in the normal range. I'm gonna check your pulse here. Your pulse rate is at 82. That's in the normal value range. Your respirations also checked us. You have good chest wall expansion, no abnormal soundings. Your breathing sounds well right now. I'm going to go ahead and check your oxygen level by putting this little tinker on. I'm going to simulate it. It's going to go on this pointer finger here. Boop. Beep. 99% oxygen level. You're doing good. Don't need any of our oxygen. And then also I'm going to check temperature here. I'm going to stimulate that as well. The temperature is 98.6. Thank you, sir. I'll go ahead and check your fingers if for any abnormal. Your fingers do not have any clubbing or anything that I noticed. No cyanosis, no discoloring. I'm going to check your capillary refill. You're going to pinch it for 1 to 3 seconds. See if it comes back. Alright, your skin came back 1 to 3 seconds, you're good there. Now I'm going to start my heart and lung assessment. I'm going to raise your head up here. So the first thing I'm going to do, I'm going to look at your neck here. I'm going to assess your neck. Have you look to the right a little bit and to the far. I'm going to twist ahead here. I've noticed you don't have any jugular vein distinction. I'm going to go ahead and feel for your carotid artery. Check the pulse there. You're doing good there. You have a pulse on that side, and I'm going to check the other side. Make sure they're both symmetrical. They are symmetrical. Now I'm going to listen for any bruits in your neck, which is very abnormal if you have it. I'm going to have you take a deep breath and hold it for me. Can you take a deep breath? Alright, thank you very much. You do not have any birds. Now I'm going to have to expose you here for my heart and lung examination. Is that okay?
Yes.
Thank you. Now I'm going to listen to your lungs first, but your chest wall expansion's looking good. Nothing abnormal there. You're not using any accessory muscles, which is very good. I'm going to go ahead and listen to your lungs. Every time my stethoscope hits your skin, I'm going to ask if you take a deep breath here. Take a deep breath for me. Another one. Another one. One more. Got two more after this. Again for me. And last one. Alright, your lungs are sounding good from the front. Now I'm just going to listen to your heart. Take a deep breath one more time. First I'm going to listen to your apical, which is on your second intercostal space, right around here. Now I'm going to slide over to your pulmonic, which is also in your second intercostal. Now I'm going to go down to your urge point, third intercostal for. Now I'm going to go down to the fourth intercostal space, which is your tricuspid. Now I'm going to the last one, which is your fifth intercostal space, which is the mitral. Thank you. Now I'm going to do it again with the back side of my stethoscope. Going to the apical again. Pulmonic. Urge point. Tricuspid. And mitral. Alright, your heart's sounding good. You don't have any abnormal findings of murmurs, S3, no friction rupture. You're doing good there. Now I'm going to have you sit up here for me, and I'm going to listen to your backside. Have you cross your hands. Thank you very much, sir. Now I'm going to put both my hands on your back and have you take a deep breath. I'm going to feel for any bony promises in your lungs and back. Take a deep breath for me. Thank you, sir. And now I'm going to listen to your lungs. I'm going to listen to 4 spots, 2 on the top and 2 on the bottom. Take a deep breath once again. When my stethoscope hits, deep breath for me. One more. Another one. Last one. Alright, thank you, sir. I'm going to have you lie back one more time. I'm going to cover you up this time. Now I'm going to look at your toes here and your legs for any skin lesions, abnormalities. So I'm going to expose your legs and feet for me. And I'm going to check your capillary refill again. Just good. It could be another pinch. Alright, you have good capillary refill, 1 to 3. Now I'm also going to check your pulses down here. You got your posterior tibialis. And you got your inside one over here. Now we're checking on both sides, make sure they're bilateral and symmetrical. And there, good. You don't notice any skin lesions, abnormalities in skin, no discolorization. They're looking good. We're go ahead and cover you back up. And I'm going to check your pulses in your arms, make sure they're both symmetrical here. Got one in your brachial artery. I'm going to go for your radial pulse. Both there. Now I'm going to go over here and check over here. Got one over here. Got a pulse over here. And my assessment's done. Thank you, sir. I'm going to go ahead and cover you back up. Make sure you're comfortable. You sounded very great, sir. I'm going to go document my findings, but first, I'm going to lay you back down. Make sure you're comfortable. You have any questions for me?
No.